Absolute risk. In oncology, the term absolute risk refers to the actual numerical probability or chance that an individual will develop a certain type of cancer or experience a specific outcome related to cancer. Absolute risk is typically expressed as a percentage or a ratio and provides important information for assessing a person's individual risk and making informed decisions regarding prevention, screening, and treatment options. To understand absolute risk in oncology, it's essential to distinguish it from relative risk. Relative risk compares the risk of an event or outcome between two groups, such as individuals with a certain exposure or characteristic versus those without it. On the other hand, absolute risk focuses on the actual probability of the event occurring in an individual over a specific time period. Absolute risk takes into account various factors that can influence an individual's likelihood of developing cancer. These factors include age, sex, family history, lifestyle choices, such as smoking or diet, environmental exposures, and genetic predisposition. By considering these factors collectively, healthcare professionals can estimate an individual's absolute risk and tailor their recommendations accordingly. Absolute risk is often used in cancer risk assessment models, such as the Gale model for breast cancer or the Tyrer-Cuzick model for ovarian cancer. These models utilize specific risk factors to estimate a person's absolute risk of developing the respective cancers over a defined period, usually 5 or 10 years. These risk assessments help identify individuals who may benefit from additional screening, preventive measures, e.g., chemoprevention, or genetic testing. For example, let's consider breast cancer. The Gale model incorporates factors such as age at menarche, first period, age at first live birth, number of previous breast biopsies, and family history to estimate an individual's absolute risk of developing breast cancer. If a woman's absolute risk exceeds a certain threshold, usually 1.67% over 5 years or 20% over a lifetime, additional interventions may be recommended, such as increased surveillance or preventive measures like tamoxifen. It's important to note that absolute risk estimates are statistical probabilities based on population data and may not accurately predict outcomes for an individual. They provide a general idea of risk but cannot account for all individual variations. Moreover, absolute risk estimates are not guarantees that an individual will or will not develop cancer, as they are subject to uncertainty and variability. Overall, absolute risk in oncology provides a quantitative measure of an individual's likelihood of developing cancer or experiencing specific cancer-related outcomes. It serves as a valuable tool for healthcare providers and individuals to make informed decisions about cancer prevention, screening, and treatment strategies based on personalized risk assessments.